Hi, I'm Brian Finestein, CEO of St. Clare's Health. Welcome to Let's Talk Health. I'm here with Dr. Ukrainskyj, Medical Director of Breast Surgery here at St. Clare's. Doctor, women and men are here to get mammograms, so at what point do they start?
So a woman who is of average risk of developing breast cancer should have her first mammogram by age 40. Now, if she's a lady who's at high risk of developing breast cancer, for example, because of her family history, then we look at when the youngest diagnosed breast cancer was in the family, and the patient should have her first screening mammogram about 10 years earlier. Now, having said that, if a patient has any kind of symptoms, for example, she feels a lump in her breast, she should get a mammogram no matter what age she is, and she will often need additional imaging studies to evaluate that. It's also important to emphasize that though we're here talking primarily about women, men do develop breast cancer, and so anytime a man feels a lump in his breast, he should have it checked out by his physician, who will then refer him for his appropriate imaging and other treatments.
Now, once you have that baseline, how often should you again have mammograms?
So a patient should have an annual screening mammogram once a year, obviously. But sometimes there are findings on the imaging studies that suggest that the patient needs to have more frequent follow-up for a finding. So for example, if there is a finding that appears to be benign but needs to be monitored a little bit more closely, the patient will need to have imaging studies in the interval between her annual studies.
Now, does it matter where you have your mammogram?
Absolutely. A patient should have her mammogram done at a facility that is certified to perform these studies and that has radiologists that are trained to read these imaging studies, as well as additional imaging studies, and be able to perform any interventional breast procedures that are needed. The Women's Health Center at St. Clare's is such a facility. We have ACR, American College of Radiology, accreditation for all the imaging modalities that we use. These include the mammograms, the ultrasounds, the ultrasound-guided core biopsies, the mammographically guided stereotactic core biopsies, as well as the MRI for the breast. Our radiologists are board certified. They have specialty training in breast imaging and breast interventional procedures. Additionally, the readings for the breast imaging studies are done in real time. So the results of the patient's studies are available to patient's physician almost immediately. And finally, another key feature of the Women's Health Center at St. Clare's is that we have nurse navigators. And these are nurses who will help the patients navigate through any situation that they find themselves because of their imaging studies.
So what happens if the result comes back and maybe it doesn't seem quite right? What's the next step?
So basically depends on what is found on the imaging studies. Sometimes there is a finding that just needs to be clarified, and the patient would need some additional mammogram images or possibly a breast ultrasound or breast MRI. Sometimes, however, the imaging studies show findings that will need to be biopsied to find out what's going on there. This can often be accomplished in a minimally invasive manner, either under ultrasound or mammogram guidance. This is done by our fully trained radiologists and their staff. Most often, the answer comes back as a benign finding, and it's something that we can monitor. And if that's the answer, well, then that's wonderful, because we've spared the lady a surgery that she might not have needed. If, however, the answer turns out to be a breast cancer, then we have a lot of information about that breast cancer, which will allow us to begin making plans on how to treat that cancer for the patient.
So talk to me more, if there is a breast cancer diagnosis, if you will, what are the next steps?
So usually the first physician that a patient will see after she's been diagnosed with breast cancer is the breast surgeon. And that's because surgery is usually the first step that the patient will need after her breast cancer diagnosis. When I see a patient in my office, we go over all the information we have about the patient's breast cancer, and then we talk about how we're going to treat the cancer, including surgery and any additional treatments. But make no mistake, breast cancer is not a disease that is treated by one physician. It is a team effort, and so we assemble a team of specialists and other clinicians that are going to help take care of this patient's breast cancer. These include our medical oncologists, who will take care of the patient's chemotherapy or hormonal therapy needs. Our radiation oncologist, who will provide any radiation therapy that the patient needs. We have plastic surgeons who provide reconstructive surgery when that is needed. In addition, we have medical social workers. We have the nurse navigators, as we mentioned before. The nurse navigators are key because, as I mentioned earlier, they see the patient through the process from beginning to end. When a patient finds out that she has a finding on her mammogram that looks suspicious, the nurse navigator will reach out to her primary care physician. She will make the appointment for the patient, and often she's there during the procedure to hold the patient's hand if need be and get her through the procedure. In addition, we offer other services that may be needed, including genetic testing and physical therapy.
Now, let me take a step back. So, obviously, early detection is very important. COVID has sort of set things back. What are you seeing, and what should men and women do when their timeline has lagged a little bit behind their scheduled time for mammograms?
Yeah, understandably, lots of patients were reluctant to come in for screening procedures or even for treatment. Sometimes it didn't really make a difference because there wasn't going to be anything that was going to be found on their mammograms. But sometimes it did make a difference, and patients came in a later stage than they might have if they had sought their screening mammogram at the appropriate time. Unfortunately, many of our patients who were diagnosed early in the pandemic were unable to have their surgery at the beginning. And so we needed to treat them with other modalities, and luckily we did have other modalities that we could use, such as chemotherapy or hormonal therapy, until we got to the point where we could do their breast surgeries. How this will affect their ultimate outcome is not yet known, unfortunately, but there are studies that are looking at this question. One other thing that I'd like to point out is that now that many women have had their COVID-19 vaccine, we're seeing that women can develop enlarged lymph nodes under the arm, on the side, especially on the side where they had their vaccine. So if a lady is due to have her screening mammogram and she has recently had her COVID vaccine, she should wait approximately 6 weeks before getting the screening mammogram. And the reason for that is that if she gets it too early, we might have a finding of enlarged lymph nodes, and we're not sure if this is related to the COVID vaccine or to something more worrisome. And therefore, we would end up doing a whole workup that might not necessarily be needed. So I think it's very important that women look at the timing of their screening mammogram in relation to their COVID vaccine shots.
Thank you, Dr. Ukrainskyj. Again, thank you, viewers, for watching Let's Talk Health. For future events, please look at our website at www.stclares.com. And to view some of these events, please look at St. Clare's YouTube.